I'm Ashley Moss.
Hi, I'm Sky Frank, X-Ray Tech.
Oh, very nice to meet you.
You as well.
Thank you. Well, first of all, I would like to thank you very much for taking the time out of your day to allow me to do this interview.
Not a problem.
I was asked to do this for my class. It's an oral communications class for the radiography program at NTC. And for this class, they would like me to learn how to conduct an informational interview, which is very different from like an employee interview when you're asking for a job. What I'd like to do is ask you questions about the clinic you work for, about radiography, and a few other experiences that you've had during this time. So,
okay.
Again, thank you very much for taking time and during your lunch break for me. I'm really appreciative.
No problem. I'm glad to help.
Well, thank you. Okay. First question I would like to ask you is, what jobs in your past led you to make the decision to go to school for radiography? What prompted you to go to school for radiography?
Well, when I first graduated high school, I went to the Tech for dental hygiene.
Oh.
I think I did 2 semesters in that, and X-ray was incorporated into the dental hygiene program. And at that time, I just didn't enjoy dental hygiene. So I withdrew from the program, and I was didn't know what I was going to do. So then I got my CNA, and then I was thinking about nursing. So then I worked as a CNA for quite a long time and decided nursing was not for me. And then I kept thinking about what I could do, and I looked into the X-ray program, and I remember in dental hygiene when I was taking X-rays, that I always really enjoyed the X-ray part of it. So I looked into that a little more, and then I just chose to go with radiography, and it was a great decision.
I can see that you're beaming. That's how I feel. That's how I feel when I talk about it. It's so exciting.
It is very exciting.
So, with the radiography program at the Tech, what did you like most about it? What was your favorite part of it?
I want to say about the program, my teachers were phenomenal. Our teachers were just great. They were so helpful. Just easy to talk to. The program itself was great, but just having good teachers that you felt, you could go to when you needed to was a huge plus, and I think it makes your success a lot easier when you have approachable teachers and all of that. And then just the stuff you learn, the stuff you see so much cool stuff, and it's just awesome.
That's great. So as far as your teachers, what classes did you feel were the most beneficial to becoming the X-ray tech, to getting into radiography?
We had, the most beneficial would probably be our positioning classes. That's every body part that you have to X-ray has, different angles to see different joints. So the positioning is pretty much the biggest thing about the taking X-rays, is you need to know how to do that, and you learn all the different positioning, but each hospital or clinic, they all have different protocols for what positioning they want for each body part. So that was a huge help. And then I would say the other one would probably be just the classes where you're learning about the equipment that you're going to end up using, the rest of your life. Because if you don't know how to use it, you cannot take an X-ray.
That sounds important, yes. So for your career, what were the educational requirements? What did it require to get into radiography? What did the program entitle?
I believe you had to take your core classes, your AMPs. I know you had to have I think biochemistry. It's been so long.
Oh goodness.
What else did you have to? You had to be CPR certified.
I think CPR certified is important for everybody.
Oh, yeah.
Just everybody, whether you're in the field or not.
I completely agree.
Oh, my gosh.
And even if you're just having kids, you should be required to take CPR.
Oh, yes.
I mean, you learn a lot.
Yeah.
It's very helpful.
In the MAH00007 class, they just, okay, now here's what
yeah.
we do.
This is CPR. Yeah. I can't remember all the core classes that you had to take, but I mean, there was quite a few, and they were all, you know, pretty beneficial to leading up to getting in the program classes. And I took all mine before I got in the program, which I think is huge.
Really?
Oh, yes.
That's important. Okay, so you took them all prior to the clinical. Is it a clinical, or is it like the program? Is it where
the program, it has a clinical component. You're in
Okay.
clinical every semester and summertime, and then you know, and then you have your classes on top of that, just your radiography classes. So, I mean, if you have those core classes, I honestly, I can't imagine doing it, having to take all those plus that. And I actually did. I had to take economics. It was not my favorite.
You're like, this has nothing to do with radiography, but
economics was
you know.
not my favorite class whatsoever. And I did it online, so that probably, I hate online classes.
Do you?
Yes, it's just, I like the, you know,
Camaraderie.
yeah, the
Yeah,
interaction.
I actually, in a little bit, I'd like to go into a little bit about communication. So I'd like to
Okay.
talk more about that, about the camaraderie and the differences between online and, one more question, and I'll ask you about that.
Okay.
So how important would you say your GPA is for your position? You know, your grades, how does that relate to your career?
In my opinion, I don't think your GPA has anything to do with how you can perform in the clinical setting. I mean, there are people that are just book smart, fly through everything, and they're great. But when it comes to the hands-on clinical aspect, that does not always mean that you're going to have the personal skills to talk to people. Like, I would say I did average. I did average in my classes, but in clinicals, I soared. I did great. I was always like ahead in my class with my competencies, but I'm a hands-on person. You know, I'm not a bookworm. You know, I like doing my hands-on stuff. So I personally, you know, don't think it's, I mean, you obviously need to pass your classes, but as far as like, oh, this person got a 4.0 and this person got a 3.5, well, that does not matter.
My mom has this this joke, and she was a firefighter for 14 years.
Oh.
And full-time for WASA. And she has this joke that, you know, what do you call the student that graduated last in his medical class?
What?
Doctor.
Oh.
You know? I mean, to me, school's important, and I like to get good grades. You know, I like to give everything that I have. But I can completely agree with you.
Right.
And for myself, I am very much more hands-on, and I would much rather be conducting this interview with you and speaking and learning about this program than going home and doing a math test online.
Right.
You know, I mean, okay, I'll get through it, but really, I'm hands-on too. I'm an action and a people listener, orientated style listener, and
I'm the same way.
Yeah.
Same time.
Yeah. Okay. So, work experiences. Can you tell me about a typical day as an X-ray tech, as a radiographer? What does your day look like?
Well, I work the PM shift, and I work 7 on, 7 off, 10-hour days. So I come into work at 1. So at Aspirus, in my department, we have inpatients that come in. So we have people coming to us, you know, they have a cold or whatever, and they need a chest x-ray. So we have that. We have surgery. And this is all coming out of our little diagnostic department. So we have surgery cases, so that's anything from a broken femur to gallbladder, spinal surgery, you name it, we do it. We do a lot. Then we have fluoro cases, so fluoro is live x-ray. So people come in, if they're having like difficulty swallowing, we'll have them drink barium, which is contrast that shows up on x-ray, so then you can watch it go through their esophagus, and the doctor can see if they have a stricture or what's going on in their esophagus. So we have that. Then we have inpatients. So these are people that are just in the hospital, whether it's they don't feel bad or they don't feel good and they need an abdomen x-ray or a chest x-ray, so then we go to the floor or we bring them to our department. And then we have the ER. So we have people coming in all day long, you know, headaches, cough, vomiting, you know, just everything. So our department, we do all of that. Of course, since I'm a PM tech, our reception area closes at 5:30, so that stops our outpatients, but we still, and floral is more of a day, during the day type of thing.
Yes.
So, but then we still have surgery, ER, and inpatients. So I mean, you're doing a lot.
Sounds like it.
No day is ever the same. It's always different, which is nice too.
Well, speaking of your day, what's the most enjoyable part of your day? What do you love the most about it? What's most valuable?
I'm a people person, so I love my interactions with my patients. I'm very compassionate, always have been. That's why the healthcare field is perfect for me. So just going into a patient's room and seeing them smile, or having a really grumpy patient come to you, and by the time they leave, they're happy and smiling. Like, that's most rewarding to me in my job.
That's beautiful. That's beautiful. I like that. So, what prompted you to work for the specific clinic that you work for? What made you say this is it? This is where I want to be. This is where I want to work.
I think when you get out of the
on you guys.
Oh, we're good. Thank you.
Thank you.
When we get out of the when we're in clinicals, Aspirus was my clinical site. And when you get out of the program, it seems like generally you get an occasional position somewhere. It seems like it's really rare to walk out of school with a full-time job. So I did my clinicals at Aspirus. So I was there my full 2 years. And then it was just really the right time, right place. They had position opened. Our team lead asked if I was interested, told me I should apply. Wow. So I applied. And I had a job before I even graduated, which is really rare. I'm very, very lucky.
Wow.
And I do like working there. It was nice because I'd already been there for 2 years. So I was comfortable there. I knew the people. I knew most of everything. So it was really nice.
It just worked out well. It just was the plan. It seems like it was meant to be.
Yes, I was very lucky.
Very, very cool. And you would recommend that, to take your clinicals at a place that you could really see yourself?
Well, you don't really get the choice. I think they put you at your clinical site based on where you live.
Oh, okay.
I think you can, suggest, I would really like to be at Aspirus or St. Clair's. I think you can suggest, and if it works out, that's fine, but otherwise we didn't really have a choice. They're just like, this is your clinical site. And Aspirus is really nice because it's so big. So you really get a lot of experience and you get to see a ton of stuff. So it's very beneficial.
What key skills do you believe are most important for your position at this hospital, at the Aspirus?
I would say, I think communication is huge. I can't think of what else, but I mean, communication really covers a broad spectrum. Just communicating with your patients, communicating with other staff. You know, if you have to go somewhere, you need to talk to the RN. If you need to bring a patient, you need to talk to the RN. It's really communicating. I mean, you really have to communicate with your coworkers, because there's just so much going on. So I would just say communication is huge.
I think, in every aspect of life,
right,
communication is so vital.
Right.
So, let's talk. I'd like to talk a little bit more about communication. As a X-ray tech, as a rad tech, you're consistently around patients. Your whole day-to-day is around patients. How vital? In what ways would you say communication? Do you have an example, of a time when communication could have made or break your day?
There's so many. I'd say some of the important ones that just come to the top of my head is one, ICU. We go to ICU. We do patients a lot. Patients are intubated, so they're not awake, but you do not know subconsciously what these people are hearing, so I always think it's super important. A lot of times we'll roll them or sit them up, so just communicating that to them in case they can hear, because I can't even imagine just laying there and having somebody just pulling you over, and you're kind of like, what's going on, but you can't talk because you got a tube down your throat. So I would say I'm always big on that in the ICUs. The people that are intubated, just letting them know, hi, I'm Sky, I'm from X-ray, I'm going to get a chest X-ray, we're going to be rolling you to your left, sliding a hard board under you, just letting them know. And then we have traumas come into the ER, and as X-ray, we are paged immediately for when traumas are there, so we're there and waiting, because one of the first things they want to do is a chest X-ray. So when you have a trauma come in, you have X-ray, lab, nurses, doctors, the EMTs that are bringing the patients in, so there's a lot going on, and just generally there'll be two of us, so that's kind of nice. So just communicating, okay, drive the portable in, let's roll this patient, I need to get my board out, telling the people around you, I'm going to X-ray, because you're supposed to be 6 feet away just for the radiation purposes.
Yeah.
So just communicating that to everybody. And then just with your coworkers, a lot of times we're so busy, so letting each other know, okay, I'm going to go do this.
Mm-hmm.
How about you go and do this? Just so you know where people are at, and we always carry phones on us so we can call if we need, oh, I'm trying to do this and this isn't working out, what can I do? Or I need help here. So those are some places.
No, that's great. That's great. Communication is obviously very, very important in all aspects. So, talking about your coworkers, what personal attributes do you feel about yourself and about them do you feel is most important for success? Do you think communication would be the most, or?
I would definitely communication.
Yeah.
We have, I want to say there's like 25 people that work in my department, and
Mm-hmm.
they're pretty much all female. There are maybe, I think there's 3 guys. So when you get that many females together, everybody's personalities are different, and it's fine. Our group at Aspirus, like we are like family. We're very, we do bump heads on stressful days, and that's going to happen. But that is one thing I love too. Are like my coworkers. They're like my family. I spend so much time with them, and we're all really good friends. We hang out outside of work. So that's really nice. And yeah, just communication. People are going to have personality clashes. That's just how the world goes. But just knowing how to let it go and just realize that's the difference. We're here to do a job together, and,
Right.
We need to get it done. And for the most part, our department is great. Everybody gets along really good. Occasionally we're like, but for the most part, we get along really, really good, and I'm very thankful for that.
That's wonderful.
Yeah.
Do you believe that radiography is a people-orientated career?
Oh,
Do
definitely.
you think it's more about the equipment, or do you think it's more about the people and communicating with the people?
More about the people, definitely.
Yeah.
The one thing I like as far as patient interaction, like I love my patient interaction, but you bring this patient here, you do what you need to do, and then bye. It's not that I don't love my patients, but I was a CNA for so many years, so I'd take care of the same people every day for hours and hours and hours. So it's kind of nice to just always have different people. Occasionally you'll see the same person so many times, but just to constantly have, different people, and it's short intervals, and it's kind of the nice part of, the care. You're not having to, I don't know. You don't have to take care of them and change diapers and all that stuff, which isn't a bad thing. I did that for many years. But just to, have the, hi, how are you? We're going to do this, and then, okay, see ya. and then the next one comes in.
Yeah.
So it's just kind of short intervals, which I like. I like that. It's nice.
Just different experiences.
And always
all day,
different
not the
people.
same thing.
Yeah,
and
not the same person all day long. Yeah, that's one thing I really like.
So, my question is if your job advances, if you are promoted, what's the next step? What would be a position? Is there a position that's higher, or would you have to go back to school?
There's a lot you can do with radiography. There's lots of different mobilities. There's MRI, CT, mammo. So a lot of those you can cross-train into. And those are obviously, you make more money doing those different modalities. So you can cross-train into those, which is really nice. Then, you know, like where I work, we have a team lead, so that's a step above. I think they generally look for a bachelor's degree, but we have had team leads that do not have that.
Okay. Is it based on, like, experience?
Yep, experience, how you handle yourself. Our last team lead, she just actually stepped down because she moved to a different area, but she did not have a bachelor's. She just had her associate's degree, and I mean, she was great. She was really great. And then there's obviously, you know, program director, and that I do believe you have to have at least a bachelor's. I'm not positive because that's never been a desire of mine to move up in management or anything. I don't want to do that. I like doing the patient care work. I've thought about going into a different modality, but I've only been an x-ray tech for maybe almost 4 years. So, you know, I'm still getting my feet wet. You learn so much, and it's just, you know, I'm comfortable where I'm at now, and right now, you know, that's where I want to be.
That's where you want to be.
Yeah, I don't want to switch anything up quite yet.
You know, even in, I'm in anatomy and physiology right now.
Okay.
And even in that class, I mean, everything you learn, you just have no idea.
Right.
You have no idea how...
Oh, yes, I remember that class.
I was excited about it. I was like, you know, I love taking pictures. I've always wanted to be in the medical field, but blood and guts and not really my thing, but I've always wanted to be in the field. So I looked a little bit into radiography, and I'm like, this is perfect.
Right.
This is perfect. I love it. And all the intricate, just everything, but I love it.
Yeah.
I get excited. I'm getting goosebumps. I love it so much. So I know you said right now that you are happy where you're at.
Right.
How would you describe the differences between radiography and radiology? And is that something that you would ever consider going back for, or going back to school and...
Well, radiology is a no. I would not want to go to school. Radiology, I would say, is more of the radiologist, you know, their study of x-rays, so they're the ones reading the x-rays. That is a ton of schooling. I want to say it's 8 or 9 years. It's a lot of schooling, additional. And I just, you know, our radiologists do a lot. They read x-rays, CTs, mammos, MRIs, ultrasound. They read everything, and then they'll do, we have interventional radiology department within our department. So that's a specialized team, and there are x-ray techs that go into that as well, and then they place PICC lines, catheters, you know, all that kind of stuff. So our radiologists, we have set radiologists that go and do that. Then we have set radiologists that go and do like breast biopsies or liver biopsies under CT. The money would be great, but I cannot see myself ever doing anything like that, and I don't want to go back to school for that long.
No.
I've done my time. I'm done.
You've gotten to where you want to be.
Yep, and I'm good with that.
And clearly worked very hard for it.
Yep.
What do you believe the average length for a radiographer? How long do they stay in their field before they move up, or they decide to go? What would you say the average length is?
I would say that completely differs. Like I work with a lady who, she has been there for 30, 40 years in just diagnostic x-ray. And she did move up. Now she's doing IR procedures. So, I mean, but otherwise she was just an x-ray for that long. And then then I work with a girl who worked in diagnostic for, I don't know, 4 or 5 years, and then she went to IR. So I think it's just a preference thing. You know, some people come and then they move to CT right away. Some people come and they stay there forever. So it's just, I wouldn't even say there's an average. I mean, it's just, I would say it's, you know, based off that person and what they want to do. Some people come into x-ray and they know right away, I want a CT job, and they work in x-ray until they can get a CT job, and then they're gone. And then some people are like, I don't want to do that. You know, and then they stay forever. Or pretty much.
Good answer. So this is kind of a strange question, but the economy, how do you feel that is going to, is it affecting, or do you feel it will affect radiography in the future? Do you believe there are a lot of jobs out there, or do you think that with the economy that's something that they might start cutting, if there are cuts in the hospital?
I think it cycles. I think there will be, like in my class, and I graduated in 2012, and every one of my classmates are employed. The next class, they're all employed. I mean, but then before that, it seemed like people were waiting, like they'd get out of school and they're waiting a year to get a job. So it's just, I think it's about being at the right place, the right time. I really don't think it has anything to do, well, I mean, I suppose it has something to do with the economy, but a lot of jobs open when this person, you know, moves somewhere, or this person decides, okay, I only want to be occasional. I'm full-time, I have kids now, I just want to be occasional. Well, there's a full-time position open right there. So I would just say it cycles. I remember my teachers always saying that too, that it just cycles. Sometimes there'll be lots of jobs, but you know, if you go to your, I'm a strong believer, you go to your clinical site, you work hard, you show them that you're working hard, you will probably leave with a job. Or they'll try to do something to get you in there, or they will remember you for when a job does come out. Because that's what I did when I was a student. I worked hard. I was always busy doing just like taking out the linens, something I didn't have to do, but I'm like, okay, this looks good. You know, I'm gonna empty these linens. And then, you know, I got a job before I was even graduated, so. Because
it showed that you really cared and that you were passionate and that you were willing to go above and beyond. And that's so important.
Yep.
Lastly, besides, I mean, you have given me incredible advice, but is there anything else? What do you think is the most important advice that you have for a student entering the radiography program? And I'm writing this one down.
It gets better. No, when you first start, it is so overwhelming. And for me, it was nothing like I expected. I thought, okay, we're going to x-ray a hand. You're just going to slap a hand on there, you know, throw a camera over it, done. And it's not like that. I mean, you have different angles that you have to do. It's just, it's so much more complex than what you think it would be. And there are days when, I mean, you're going to go home crying. We've all done it. Because it's just stressful. It's stressful. It's overwhelming. You're learning so much at once, and you're just like, ah. But it gets better, and you just have to keep trucking along. And in the end, it is very rewarding. It is a great career. I love it. I'm very happy that I went with radiography versus dental hygiene, or it just fits my personality, and it's just, I love my job. I do have some days, like everybody, but overall I do love my job. It's great.
Well, it just shows, you know, you talk about it, and like I had said earlier, you know, I get goosebumps talking about it because it's so exciting.
Yeah.
It's so, even though it is complex, and even though it can be, even just the classes I'm in now, you know, anatomy and physiology, and, you know, it can be very, very stressful, you know, but it's clearly rewarding.
Yes.
Clearly rewarding because, you know, it just from what you've told me, all the hard work that you put into it has definitely paid off.
Right. Definitely.
Well, Ms. Frank, I would like to thank you so, so much for taking the time to let me do this interview with me. school, so important. Studying, so important. But to actually be able to sit down and hear this information from somebody who's doing this day to day, it's really enlightening, and it's exciting.
It is.
It's very exciting.
I'm excited for you.
Yeah, this is
awesome.
What a great experience.
Yeah, I'm happy to share it.
I really appreciate it, and
No problem.
I'm going to let you eat your lunch.
Okay.
Because I don't know how much time you've left on your lunch, but you've taken a lot of time to allow me to do this. We do have an evaluation that my professor would like you to fill out.
Okay.
It's an evaluation about my eye contact. Was I prepared? Was I professional? If you don't mind taking the time to fill it out, I already have a stamped envelope for you.
Okay.
Just slip it in the mail, and that would be wonderful. That would be wonderful. I would really appreciate it.
Okay, no problem.
Thank you so much.
You're welcome.
This has been great.
Bye.
Bye.
Did you have the room reserved?
No.